Hi, my name is Gabrielle Entile with Drug Topics, and today we're talking to Richard Scholz, Chief Strategy Officer of ERxDirect, about telemedicine and how it's been aiding the COVID-19 pandemic. Rich, thanks so much for joining me today.
Gabriel, it's my pleasure. Thank you for having me.
So I'd like to start with your professional background and how you came into your position with ERxDirect.
Fantastic. I'm glad to provide that. Somewhat of a long history, so bear with me. But my role is to lead strategy for the company's consumer-centric product designs, consumer-centric implementation strategies, and consumer recognized sustainable value. And as all of us in the industry, each of us draws on past experiences to form their foundation for their decisions and the paths that they take. I've had the absolute blessing of being able to view healthcare and most particularly pharmacy care through many unique lenses over 45 years in the industry. And it's through those lenses that I form the basis for our strategic path. I started out as a practicing pharmacy in the independent, small chain and chain environment. I've been a regional chain executive as a pharmacist, and also was a early PBM founder and CEO of an early PBM, which now is part of Express Script. I was co-creator along with Brian Slusher, who is our current ERxDirect CEO. We were co-founders of Strategic Health Alliance, which is now the PSAO that's now known as McKesson Health Mart Atlas. I'm an attorney, and I've represented pharmacists and pharmacies in different types of environments. And I'm also a registered lobbyist in Washington, D.C. on health policy, focused primarily on pharmacy. So with that, like I say, it's a diverse lens, and that's what I enjoy about the pharmacy training that I've had, the pharmacy background. It's given me the opportunity to apply that lens to every segment of our business. And every business I've ever been in, everything I've done with healthcare is the key is the patient. Now the patient/consumer, they've got to be central to the strategy, or it can't be successful and it can't be sustainable. And consumers are flexing their muscle in healthcare more than ever before, and I think that's a welcome change. We need consumers to be empowered and to be part of their own health initiatives. With that, Brian and I have reunited over the last 10 years after our time together as Strategic Health Alliance. And we looked at the technology that was coming into the market and how can we assist providers, pharmacy and clinical providers to access patients more effectively, more efficiently. And that's the initiative of Health in Motion and ERxDirect.
So can you give us a little bit of what your current day-to-day looks like once the outbreak started?
Well, the day-to-day, what the outbreak, we're not a COVID initiative per se. We're a healthcare initiative, and our charge is to bring efficient access to healthcare, increase quality of healthcare, increase continuity of care, bring healthcare to where consumers are, and try to decrease the complexity of the process. Healthcare has grown into a very complicated maze for patients. And part of the beauty of technology is ways to make that maze much more manageable for patients. Because if the patients, if through frustration, through lack of access, whatever, they abandon their pharmacy therapy or any of their therapy initiatives or care plans through their physicians, is then we have a failure in outcome. And it's not necessarily because we weren't capable of getting a positive outcome. It's just that there was space between the dots that didn't get connected. Part of telehealth, part of our initiative is just connecting those dots. What COVID has been is an accelerant to that, because not only has COVID as a disease state put pressure on healthcare, but it's also brought into the spotlight is the importance of chronic disease management and prevention. And the reality is that our companies were born to make healthcare more efficient, get it to people more efficiently where they work and where they congregate. And that goes to chronic disease management. So the COVID per se has been a true accelerant to the acceptance of the type of healthcare that we're advocating for.
And so, can you kind of break down how does telemedicine work? Is the nature of telemedicine to replace the maze that you mentioned that healthcare is, or to more supplement what current practice has?
Uh, First of all, is that I clearly supplement. I think that replacement would be a far overreach. I think that there's a lot of things that we can do through telemedicine. Is in within the current practice. First of all, is the current practice of healthcare is professional dependent. Professional clinicians, professional pharmacists, professional dietitians, professional in behavioral health. All these professionals are the mosaic that brings us to healthcare. The key is how do we get them to the people more effectively and more efficiently? So that's truly a supplemental role. We see that as not replacing health. I mean, healthcare providers are the key, and empowered patients are the key to healthcare. So our goal is not to replace. Our goal is to enhance. When I talk, and I think it's important that you understand, at least from my perspective, what telemedicine is. First of all, is I'm only involved in all my experience has been in the outpatient world. So we're not talking telestroke in the hospital, those kinds of cares. Those are different. What I'm looking at in our arena for telehealth is when, in a basic sense, is there's a clinical encounter and the patient is in one location and the provider is in a different physical location. And then the connectivity in those endpoints has great diversity even within our world. And I'd like to tell you some about that diversity, if I may. Is Health Emotion Network's a model of care delivery that focuses on wellness through innovation, improving health management. And we do that through personalized care. And that's personalized care with your provider. That's the goal, is you have that relationship with your provider. Our goal is to enhance that relationship and multiple relationships and then coordinate them so that maze we talked about earlier is not so complex. Our care space is our hallmark virtual clinic. This is a clinic that is designed to put on an employer worksite. It's also used in campus care environments, also used in our connected health hub clinical sites, which is it's actually a brick and mortar clinic with dedicated rooms for digital health and for virtual health and telemedicine. That allows those brick and mortar sites to now enhance their offering to local patients, so that they can not only host a in-person current practice, but also host a visit for a patient to a specialist that may be at a tertiary care facility, 60 miles away, so that patient doesn't have to interrupt their day and go to the city or to wherever to get that additional critical care or additional clinical care through a specialist. So what we're looking at is really enhancing portability. But our care space is what's the hallmark of it is that it's synchronous communication of medical data to the provider. So the professional clinician, they get real-time heart and lung sounds. They get real-time detailed high-resolution pictures. There's a nurse at the bedside that at the exam table, helping with the medical devices and working with the physician for doing the hands-on care that may be needed or desired for that physician to make the proper diagnosis. So it's a very, very large scope of care. We also have the direct-to-consumer components where the physician can do a virtual visit directly to the consumer on a personal device. But again, it has utility, but it doesn't have as robust diagnostic utility as does the care space. So we see a place for all of that. And when we see a pharmacist as part of that healthcare team, we see a pharmacist being imported into each of those different environments to bring that pharmacy knowledge to that encounter and to that patient, again, as part of that healthcare team.
Rich, thank you so much for joining us today and for offering your expertise, and stay safe.
I appreciate it. Thank you so much.